Hi, thank you for coming out between the two storms. I guess we are having another storm showing up tomorrow pretty early. So I'm really excited to talk to you about Chinese medicine. I'm also a naturopathic doctor, but I also really love Chinese medicine. It's a really old system of medicine, maybe one of the oldest. It's over 3,000 years old, and it's still around. It's still living and breathing and evolving. But the theory, it has a very strong foundation, and over time, different doctors have observed different symptoms, and they've been able to come up with different treatment plans. And probably all my patients over time, one way or another, I always pretty much say to them, let's try acupuncture. They usually lots of times come to me for just general physicals, well-woman exams, PAPs, but then they start noticing that they have symptoms that they tell their other doctors that their doctors dismiss or don't really understand what they are. And in Chinese medicine, there's a lot of unusual symptoms that people talk about that Western medicine doctors don't really recognize, but it's within the language of Chinese medicine. So I always have an idea or an approach of how to approach it. And so they invariably get on the table and experience acupuncture, and generally most people find it really calming and relaxing. So I'm going to just go down. So you've probably seen at one time or another the Meridian charts, and the Meridian chart is really important in Chinese medicine. It's really the foundation. It's the different channels or rivers that the qi or the vital force run through. There's 12 main meridians in Chinese medicine, and if it's not flowing freely, then we start noticing different symptoms, and different meridians will have different types of symptoms. Somebody will experience certain types of pain, certain types of digestive issues, certain types of emotional issues will start coming up. We might start seeing depression or anxiety, and so it's really up to the practitioner to ask the right questions to try to figure out where the imbalance is happening. And where does this qi come from? What is qi? What is this vital force? We really believe it's the whole universe is this qi or this vital force. And there's different forms of qi. Qi really takes on different hats. It can be more what we're seeing here, the more physical form, but it could also be a more sort of ethereal form, your thoughts or your emotions. So today, since we're talking more about anxiety and depression in Chinese medicine, it has a lot to do with emotions, and we'll get to that. But next, I just want to talk about a little bit about what is acupuncture in Chinese herbal medicine. What can we treat? The World Health Organization really says there's 43 different common ailments that Chinese medicine or acupuncture can treat. Some of them are respiratory disorders like common colds. You'll see disorders of the eye, mental, emotional issues, so anxiety, depression, stress, insomnia. And a lot of people associate acupuncture with pain conditions, so there's a lot of like low back pain, neck pain. You also will see different digestive disorders. On this screen, you'll see there's a lot of neurological disorders, sciatica, migraines, headaches, disorders of the mouth, toothaches, ear disorders. I treat a lot of tinnitus. And reproductive system disorders. So I treat a lot of women with fertility or polycystic ovarian syndrome. We'll see a lot of menopause or women who are experiencing a lot of morning sickness who are pregnant. So this is from the Wangde Nijing, which is one of the oldest books in Chinese medicine, over 2,000 years old. And even back then, they recognized that the 7 primary emotions, which we consider the internal causes of disease, are really the primary reason how the imbalance in the body starts. So anger, this is talking about how qi or the vital energy, the different ways it can express itself. So anger causes energy to rise, joy causes energy to slow down, grief causes energy to dissipate, fear causes energy to descend, fright causes energy to scatter, exhaustion causes energy to wither, worry causes energy to stagnate. And so these 7 primary emotions, in Chinese medicine, emotion is really normal and healthy, but the issue is if it becomes repetitive, the same emotion over time, or if it's really explosive, if it's not transformed and expressed well, we start seeing different pathologies within the different channels or meridians. And within these 7 emotions, it's even more refined. There's even more emotions underneath those 7 categories. So a lot of the internal causes of disease are really first these dysregulation with the emotions. And then there's 6 external causes that we're not going to talk about tonight, and those have to do more with the weather. And then there's non-external and non-internal causes, and those have more to do with diet, lifestyle, overexhaustion, overwork, excess stress. So here on the next 5 slides, I'm going to just talk about some studies that they did find that acupuncture was just as effective as antidepressants, or it was a really great adjunct that it actually augmented the antidepressants. Here it's just this meta-analysis is just really explaining that acupuncture was working just as well as SSRIs, and it was actually helping the SSRI work better, the selective serotonin reuptake inhibitor medication. And this is just reinforcing too, in studies they're seeing gene regulation, and they're also seeing that the neurotransmitter serotonin is upregulated. Another study is just finding that it's equally effective as another SSRI medication. And it was actually significantly more effective than like a sham acupuncture, and that acupuncture was actually a really good adjunct, or actually to use it singly instead of medication. Another thing is depression and insomnia is relieved by acupuncture. We do see in studies when they do scales looking at your sleep, and then also doing studies that with acupuncture we do find that people fall asleep faster, they have less wakenings in the night, they have a deeper sleep, and then subsequently we do find decrease in depression and anxiety. And here with active military personnel, they do find that acupuncture is effective as a standalone to decrease PTSD, and then there's also these secondary effects. They find that they have less depression, less anxiety, less physical symptoms. I do treat a lot of people who do have PTSD, and a lot of ear auricular acupuncture is really effective. And then here is just talking about how acupuncture is really effective for generalized anxiety disorder. It actually is a lot of the medications for generalized anxiety disorder, like benzodiazepines and SSRIs, have a lot of side effects, and that acupuncture is actually, as a standalone treatment, is really effective, and you won't have the side effects. Okay, so here is from our Synergy Goals site, which is our supplement company and educational company. But this is really find your balance. How do you find your balance? How do you maintain your chi? How do you keep your chi, your vital force, in balance? And a lot of it has to do with stress management. You know, one thing is about how are you managing your emotions? How are you transforming them? Another thing has to do with food. In Chinese medicine, there's this concept that you want to eat a wide variety of food, a little bit of everything in every category if you can. But also, if you're under stress, you really want sort of this rainbow diet, a lot of different colors of foods. And you also want to have sort of an anti-inflammatory diet. So you want to reduce your like caffeine intake, your sugar intake, white type of flour. I think of white foods like white potatoes, white flours, white breads. And then also sleep is really, really critical. With that, you really want to give your time this reparative, restorative time period to sort of balance your day, especially when you're under stress, and it's really, really critical. And I think that the more stressed we get more wired and tired in the evening, and we have a harder time falling asleep. So sleep hygiene becomes really critical. And then exercise. Exercise in Chinese medicine is really important, that you do a lot of restorative type of exercise. So you may have heard of like Qigong or Tai Chi. Restorative yoga is really critical. Slow walking, especially when you're under stress. And then Dr. Lynn talked a little bit about supplements. Really, supplements are, we use supplements to sort of supplement your diet, the deficiencies, and also because under high stress, our digestion just doesn't work very well in our digestive enzymes. So you will find that lots of times one of the key things that we recommend is a digestive enzyme to help you break down your food so you can get your nutrients that you need. The next two slides, I'm just talking about the energetics in Chinese medicine of food. Dietary therapy is really critical in Chinese medicine. And when you are under high stress, you want to eat, especially if you're experiencing anxiety and depression, you want to eat a lot of foods that are more in the neutral category. And so in Chinese medicine, like in fruits, it's figs and grapes and red dates. In the vegetable category, you might see carrots or corn, or they put olives there. But and then you might see in the grains and seeds, almonds and I can't read all of that, sesame seeds and rice. It's really critical to sort of eat more in this neutral category. With emotions tend to be heat producing in the body, and so you might eat a little bit more on the cooler foods, but after 2 or 3 weeks, if you don't feel like you're getting better, you really want to see an expert in this category to make sure that you're getting the right foods, and then really be mindful to your own wisdom of your body. If you know you have a food sensitivity or a food allergy, then avoid those foods in the neutral category or any of the categories. So here it comes to what I'm really excited about, because what Dr. Lynn was talking about, we do see in our clinical practice a lot of people, we see this pattern, which is really in Chinese medicine, of people being really overstressed, overworked, having difficulty sleeping, having difficulty with digestion. And so we really were seeking out formulas that address that. And so you'll see on the left the synergy balance. And the synergy balance I'm really excited about because it has a really traditional Chinese formula called Xiao Yao Sun. It's one of the oldest formulas. And it's really designed to help the liver meridian, to calm it down with stress, and also to help support your digestion at the same time. And then there's other added herbs, Western herbs in there that such as rhodiola, that are really balancing to the neuro-endocrine adrenal system that Dr. Lynn was talking about. And then that's a formula that you might take for 4 to 8 months at a time, especially if you've been under a lot of stress. And then we have cool composure. So cool composure has a lot to do with when you think about anxiety, and you're feeling that you're having a really hard time thinking, your heart is racing a lot, you're going through a lot of stress. And so you might take this for a month at a time while the other factors in your life get more under control, when you're eating better, sleeping better, and then take a break from it. But you can always come back to it, and you can always blend the two together. And then sort of our trio, and I love the name Adrina, Synergy Supreme. This sort of a takeoff of Athena. But Adrina Synergy Supreme is really designed to help support the adrenal glands. So when we're under a lot of stress, we have a lot of that fight or flight response. And over time, we see at nighttime, we can't sleep. Once again, we get that wired but tired feeling, and then we feel exhausted when we wake up in the morning. And then if it keeps going on over time, we notice that we're just kind of flatlined during the day, and we have a hard time responding to the stress. And so this is a really nutritive, restorative formula. It combines certain nutrients and herbs to help support the adrenal glands. It has some B vitamins in it, like B5, B6. It has vitamin C. It has some Ayurvedic and also some Chinese herbs in it. So it has some ginseng, ashwagandha. It has L-tyrosine in it, so some neurotransmitter support as well. So this is sort of our mood support package that's really, we've put a lot of thought into it, just because over time, just clinically what we've seen. So So I'm really, I'm really excited to be here to sort of just talk to you about Chinese medicine, which is really my passion, and sort of introduce some of our new line. And then I'm going to hand off to Dr. Lynn.